same number of sympathetic of the spinal nerve. But some of the ganglion merge together, and we say that 22 or maybe 24 sympathetic ganglion we have, which are located parallel to vertebral body, vertebral column. In the neck, we have
Wait. Just
Okay.
wait.
what?
Just the ganglion cervical.
Yes, yes. Look at the, it is sympathetic chain, which is ganglion attached together and late sympathetic chain. But in the neck, look at here, in the neck just we have 3 ganglion. Okay? Superior cervical sympathetic ganglion, middle and inferior. Okay? Superior ganglion. Superior ganglion. It is about 2 to 3 centimeter. So it is a big ganglion. It is the biggest ganglion in the cervical area, and it is located at the level of transverse process of C2 and C3. Okay? So 2 to 3 centimeter, 2 to 3 centimeter. Its location is located
C2.
anterior to transverse process of C2 to C3. It is the biggest. Middle ganglion. Middle ganglion, it is the smallest ganglion in the cervical area. It is located at the level of C6.
C5.
Inferior ganglion. C6 transverse process. I am talking about transverse process because these ganglion are located anterior to transverse process. And you know that sympathetic ganglion are located posterior to carotid sheath. I am assessing and superficial to deep. Okay, deep to carotid sheath we see sympathetic ganglion. Inferior ganglion is located at the level of C7. However, in 81% of people, inferior ganglion merge with the first thoracic ganglion and they make stellate ganglion. Okay? They merge with once thoracic ganglion and make stellate ganglion. Okay? Stellate ganglion is located, look at here, is located anterior to number 7 transverse process of cervical vertebra. You know that. What is the function of sympathetic nerves? Sympathetic nerve, sympathetic is stimulated during stress, during anxiety, yes, during scariness. It is the function of sympathetic. However, sympathetic ganglions have some fibers. Okay, I draw this, I raise this to draw another thing. We have some fiber, spinal fibers. Spinal fiber. What are spinal fiber? Fiber from sympathetic ganglion which insert to the spinal nerves and travel with the spinal nerve to arrive to another part of the body. They are named a spinal branch of sympathetic ganglion. Vascular. What are vascular? Yes, they are located near the vessel. For example, in the frontal lacerum we have, do you remember deep petrosal? Deep petrosal was a branch of the sympathetic near carotid. For example, carotid nerve. When I say carotid nerve, it is a vascular nerve. This is the vascular of sympathetic. Another fiber are cardiac fibers. Okay? So we should assess this branch of the three ganglion. The first is spinal. The spinal from the superior ganglion, the spinal branch, go to C1 to C4. Okay? Look at here. It is superior, is the biggest. Yes? A spinal branch of superior go to C1. Look at the spinals. Yes? C1, 2, 3, 4. They arrive, and after when arrive to this ganglion, to these fibers, they arrive to cervical plexus. And by the fibers of cervical plexus travel to another area. Okay? The spinal branch from middle ganglion go to C5 and C6. Look at here. Look at here. It is a middle. Middle is smaller than, is the smallest during the ganglion. They go to, look at here, they go to C5 and C6. Okay?
The brachial plexus?
Yes. C5 and to C6 go to brachial plexus. Okay? From inferior ganglion go to C7 and C8. Also, they go to brachial plexus. They are a spinal branch of this ganglion. Vascular branch. Vascular branch from superior ganglion. From superior ganglion is located in the superior part. It is located near the base of the skull. So, the vessels which are related to the base of the skull, I know that internal carotid artery insert to the base, yes? So I have carotid nerve. Carotid nerve. It is located around the time.
بچه حسین علی
الان
چیه؟ ببخشید آقا
خواهش
این راجبه پاسپورتش یه مشکلی پیش اومد.
Carotid nerve. Carotid nerve is located around internal carotid artery. Another jugular nerve. What is jugular nerve? It is sympathetic fiber of the superior ganglion which arrive to internal jugular vein. Okay? From middle ganglion. From middle ganglion, I have inferior thyroidal nerve. Inferior thyroidal nerve. I means that it's travel by inferior thyroidal artery. Okay? Travel superiorly. From inferior ganglion. From inferior ganglion, look at here. Inferior ganglion, it is near to here.
Brachiocephalic.
Subclavian. Okay?
Subclavian.
It is near to subclavian. So at this level, I have subclavian nerve. Okay? The nerve of the inferior ganglion which are located, look at here. They are located around the subclavian artery. Okay? Cardiac branch. Cardiac branch, also all of the cervical ganglion, they have cardiac branch. From superior, from middle and from inferior, both, all of these three ganglions, they have cardiac branch which insert to superficial and deep cardiac plexus. Okay? Here we have two exceptions. From middle ganglion, I have a nerve which is named ansa subclavian. What is ansa subclavian? I say that. Look at here. Look at this fiber. Can you see? Ansa subclavian is a fiber of middle cervical ganglion which travel inferiorly, run around subclavian artery to arrive to straight ganglion. Okay? It is named ansa subclavian. Also, another branch is here. It is the branch, the exception which you should know at this area. Pharyngeal, another branch is laryngopharyngeal. Laryngopharyngeal nerve. What is laryngopharyngeal nerve? Also, it is a sympathetic fiber from superior ganglion. From superior ganglion. What is the function of laryngopharyngeal? They go and merge with branch of the vagus, with branch of the glossopharyngeal to make pharyngeal plexus. Okay? Horner syndrome. What is the Horner syndrome? Horner syndrome is any damage to the cervical ganglion, especially superior cervical ganglion, or any damage to the fibers which are derived from the superior and middle cervical ganglion. You know that this sympathetic fiber arrives to another part. Okay? Horner syndrome is related to the damage of the fibers. For example, one of the signs of the Horner syndrome is ptosis. What is ptosis? Ptosis is depression of eyelid, upper eyelid. Okay, is named ptosis. Why? Because some of the fibers of levator palpebral superioris muscle. Here we have levator palpebral superioris muscle. Okay, some of these fibers are innervated by sympathetic nerve. If we cut this sympathetic nerve, we have ptosis. Okay, so it is one of the signs of this. Another sign is meiosis. What means meiosis?
Dilation of
No. Meiosis is narrowing of the pupil. Here in the central part we have pupil, yes? We have meiosis and midrios. Midrios is dilation. Meiosis is narrowing. Okay, so what is the role of the sympathetic in the pupil? Bigger dilation, yes. Sympathetic made dilation. If I cut this sympathetic fiber, I have narrowing. I have meiosis. Okay, so meiosis is another sign of Horner syndrome. Okay, another sign is anhidrosis. What means anhidrosis? You know that we have sweat gland in the skin. Yes, the sweat gland are innervated by sympathetic fiber. Okay, so if I cut this sympathetic fiber, this area is dry. Okay, we don't have secretion of the sweat gland at this area. This area is dry. It is named anhidrosis. Okay, another sign is exophthalmos. What is exophthalmos?
Bulging of eyeball.
What?
Bulging of eyeball.
We have enophthalmos and Exophthalmos. What is enophthalmos?
When the eyeball goes inside more to the more into the socket.
Yes, enophthalmos is located in the depths. Exophthalmos and enophthalmos. Okay, enophthalmos. The eyeball is located in the depths. Is located in the depths of the orbital cavity. Exophthalmos, okay, is bulging to anterior part, bulging to the front. Yes, it is named exophthalmos. So you know that your eyeball, around your eyeball, we have fatty tissue. This fatty tissue is innervated by sympathetic fiber. So if I cut this sympathetic fiber, this fatty tissue will be shrinkage, will be small. So what we have exophthalmos or enophthalmos?
Enophthalmos.
Yes, we have enophthalmos. Enophthalmos, anhyptosis, ptosis, and meiose. They are 4 signs of Horner syndrome. Horner syndrome is any injury to sympathetic ganglion or sympathetic fiber in the cervical area. Okay? Go to posterior triangle. Then we have a brief review of the posterior triangle and its border. You know that lateral area is the area which is created by SCM and posterior triangle. Yes? The boundary of posterior triangle anteriorly is posterior border of SCM. Posteriorly anterior border of trapezius. And you know that we separate posterior triangle into another triangle by inferior belly of homohyoid. Here we have occipital triangle. Here we have supraclavicular triangle. Okay? The structures in the posterior triangle are the muscles. For example, the scalenus muscles, which are covered at this area. Another structure at this area, I say that external jugular vein at this area pierces investing fascia to insert to the posterior triangle. Yes? Another part in the posterior triangle, I have in the supraclavicular triangle, I have subclavian artery. So I should assess subclavian artery and its branch when I am explaining the posterior triangle. Another structure in posterior triangle, you know that we have brachial plexus. Yes? Brachial plexus has 2 parts. Supraclavicular part, infraclavicular part. Supraclavicular part of brachial plexus, which are the roots of the brachial plexus, and the trunk of the brachial plexus, they are located in the posterior triangle of the neck. And you studied brachial plexus, yes?
Yes.
So, who can explain brachial plexus? Okay. Scalenus muscle. I said that scalenus muscles are located in the posterior triangle. I have 3 scalenus muscles at this area: anterior, middle, and posterior. Look at here. Which muscles are there? They are perivertebral muscle. Look at here. They are perivertebral muscle which are longus, colli, and here you can see perivertebral muscle, and here you can see scalenus muscles. For scalenus muscles, you should, for better learning, know these two numbers. And 46. Okay? For determining the insertion and the innervation of the scalenus muscle. Anterior scalenus muscle, its insertion is anterior tubercle, look at here, anterior tubercle of the transverse process of 36. What is 36? Number 3, 4, 5, and 6 cervical vertebra. Okay? It is insertion of anterior, origination of anterior scalenus muscle. When anterior scalenus muscle travel inferiorly in the superior surface of the first rib, we have a tubercle. Do you remember? Yes. Scalene tubercle. This muscle attached to the scalene tubercle in the superior surface of the first rib. Okay? What is innervation of the anterior scalenus muscle? 46.
Anterior.
Okay? The cervical
4,
nerve number
4, 5, 6.
5 and 6. What is the function of scalenus, anterior scalenus muscle? Flexion. Yes? From the cervical area to the first rib. So it is flexion. Another scalenus muscle is middle scalene. Middle scalene is, look at here, it is middle scalenus muscle. It is the biggest scalenus muscle in the posterior triangle. So, I am saying that it is biggest. Its origin is all the posterior tubercle of transverse process of all cervical vertebra. Okay? All cervical vertebra, its origin of middle scalene. What is insertion of middle scalene?
The first
Remember
rib.
to the first, yes, in the first rib also we have the
Posterior.
insertion of the middle scalene. What is the innervation of middle scalene?
C3
C3 to
C8.
C8. Okay? C3 to C8 is the innervation of the middle scalene. Another scalene is, another point, you should know one point in the middle scalene, which you have studied in the brachial plexus. You know that two nerves of brachial plexus pierce or perforate middle scalene.
Root or nerve? Root?
Two nerves. Yes, I can say that you are near. These two nerves are derived from the roots of the brachial plexus. Which nerve? You said by chance, yes? Which nerve? in the
Scapular.
brachial plexus?
Scapular nerve.
What?
Scapular.
No.
Brachial
You are
plexus.
near. Dorsal.
Dorsal scapular.
Dorsal.
Scapular.
Scapula.
Scapular. And another nerve?
Long thoracic nerve.
Yes. Long thoracic. You know that dorsal scapular nerve and long thoracic nerve, they are nerves from
Brachial.
roots of brachial plexus. Brachial plexus has roots, trunk, cord. Yes,
Yes.
they are from roots.
Root.
Dorsal scapular is from, we have posterior root.
C5.
Roots means, for example, when I say roots, I mean that C5, C4. Okay? It is root. T1, for example, it is root. Okay?
Yes.
Dorsal
C5.
scapular is from C5.
C5.
Yes. Long thoracic is from
C5.
C.
C6. C7.
Yes. C5,
C6,
6, and
C7.
C7. These two nerves pierce middle scalenus nerve. Another middle scalenus muscle. Another scalene is posterior
Posterior
scalene. The origin of posterior scalene is
C4,
46,
6,
C4, C5, and C6.
C6.
Posterior tubercle of transverse process of 46. It is origin of posterior scalenus muscle. What is insertion?
External secondary.
Lateral surface of second rib. It is insertion of posterior scalene. Okay? What is innervation of posterior scalene?
C6 to C8.
Yes. C6 to C8 is the innervation of posterior scalene muscle. What is function of posterior scalene?
Lateral flexion.
Lateral flexion. But if your cervical vertebra are fixed, they can have
Elevation.
elevation, they can elevate the ribs so they can have respiratory function. Okay? They can elevate the ribs and they help you during inspiration. Another point at this area. Anterior scalenus muscle. You know that they are the muscles which are covered by a fascia. Which fascia? Perivertebral fascia. Yes? Perivertebral fascia covers all this fascia at this area. Look at here. I still remember perivertebral fascia is some part of deep fascia. Yes?
Yes.
Deep layer of deep fascia cover all this area. Anterior scalenus muscle in both sides has adjacency with the phrenic nerve. Okay, when we find the phrenic nerve in the cadaver, when we arrive to the scalenus muscle, anterior we find anterior scalenus muscle and we find phrenic nerve which is located anterior to anterior scalenus muscle. Middle scalene, posterior scalene. Another muscle is levator scapula. Okay, from anterior to posterior. Posterior to posterior scalenus muscle, I have levator scapula. Levator scapula originate from posterior tubercle of transverse process of C1 to C4. Okay. What is the origin of levator scapula? What is insertion of levator scapula? Which part of the scapula?
Medial border.
When the superior border arrives to medial border. Okay, superior border near to the medial part is the insertion of levator scapula. What is innervation of levator scapula? Decrease nerve.
Dorsal scapula.
Dorsal scapula innervate levator scapular muscle. Posterior to levator scapula. Okay? When I assess posterior to levator scapula, I see a flat muscle which covers this area. Okay? Splenius capitis. Look at here. We have two splenius. Splenius capitis and splenius cervicis. Splenius capitis at this area originate from superior nuchal line at this area, superior nuchal line, and travel inferiorly to arrive to the ligamentum nucha and to the spinous process of the first three thoracic vertebrae. Okay? What is the function of splenius capitis? Erection of the head. Look at here. The function or backward of the head. The function of the splenius capitis. So, I said that in the posterior triangle, in inferior part we have supraclavicular triangle. I said that in the supraclavicular triangle I have a artery, subclavian artery. No, we should assess the branch of the subclavian artery. Subclavian artery in right side is a branch of
Brachiocephaly.
subclavian artery. Yes, yes, she's true. Subclavian artery is a branch of vagus nerve.
Brachiocephaly.
Okay? In the right side,
Brachiocephaly.
brachiocephaly. In the right side, subclavian artery branch from brachiocephaly.
Brachiocephaly. On the
In
left
left
side,
side,
aortic.
Aorta.
from the aortic arch. Okay. Look at here. When subclavian artery travel laterally and when arrive to lateral border of the first rib, it becomes auxiliary artery.
Auxiliary.
Okay? The lateral border of the first rib separate auxiliary artery from subclavian artery. We divide the subclavian artery in three parts according to the insertion of anterior scalenus muscle. Okay? The first part of subclavian artery is located medial to anterior scalenus muscle. Second part of subclavian artery is located posterior to anterior scalenus muscle. Third part of subclavian artery is located lateral to the anterior scalenus muscle. Okay? The adjacency of subclavian artery here. In the left and in the right. Okay? Here, if at this area I have insertion of which muscle? Anterior scalenus muscle. Okay? Here is insertion of anterior scalenus muscle. You know that anterior scalene is located anterior to this artery. What are the adjacency? In both sides, the first part of anterior scalenus muscle in both sides is adjacent to here and here. Internal jugular vein and vagus nerve. Okay? Vagus nerve, internal jugular vein. In both sides, it is anterior, it is
Posterior.
posterior. Here is posterior. Okay? Left side, right side.
Right.
In left and right, in both sides, anteriorly we have these two structures. You know that in the left side we have a lymphatic trunk, which is named thoracic duct. Okay? So at this area also we have thoracic duct anterior to the first part of subclavian artery. Thoracic duct. In the right side, which is structure from vagus nerve, you know that recurrent laryngeal nerve, okay? Recurrent laryngeal nerve is located in the right side at this area. Recurrent laryngeal nerve. Yes? In the right side, recurrent laryngeal nerve is branched from vagus nerve and run around the first part of subclavian artery. I mean that, yeah. Look at here. Okay? in the posterior view, in the posterior adjacent to the first part, also I have recurrent laryngeal nerve. Yes? Do you remember ansa subclavian? What was ansa subclavian? It was a branch of the middle cervical ganglion and run around the subclavian. So at this area also I have ansa subclavian. Yes? Here also. Both sides. Yes. Ansa subclavian in both sides. Ansa subclavian. Yeah. Ansa subclavian. What's that? Okay. Yeah, enough. So, the anterior adjacent of the first part. Also at this area I have phrenic nerve. Here is
thoracic duct.
phrenic nerve. Phrenic nerve in the left side is anterior adjacent of first part of subclavian artery. Look at here. Ansa subclavian, anterior, inferior and posterior. It runs around the first part in both sides. Vagus nerve and internal jugular vein in both sides. They are located in the first part, anterior to the first part. Yes. Thoracic duct. We have just thoracic duct in the
Left side.
So thoracic duct is anterior, adjacent to the first part. Phrenic nerve in the left side. Do you remember I said that phrenic nerve is located anterior to which muscle? Anterior. The spinal
Anterior
muscle.
muscles.
It is the level of which muscle? Anterior.
Anterior.
Spine. In the left side, phrenic nerve travels some medially to arrive to the first part of the subclavian. But in the right side, phrenic nerve located at this area. Okay? Phrenic nerve located anterior to
Anterior.
spinous muscle. And the artery is located posterior to this part. Yes, posterior to this muscle. Okay? They are adjacency of this area and of this area. Posteriorly. What is the posterior adjacent of the subclavian artery? Pleura. Cervical pleura. Yes?
Yes.
Look at here, if at this area. What is this? This is the first rib. Yes? Here is, what is this tubercle? The scalene tubercle. So, anterior scalenus muscle attached to this area. Yes?
Yes.
Here we have the artery. Yes? Subclavian artery. Where is the middle subclavian, middle scalenus muscle? Yes? Here we have middle scalenus muscle. Okay? So, look at here. It is anterior part. It is middle part, it is posterior part. Okay? I draw it at this area. Yeah. It is anterior scalene, middle scalene. Anterior part. Middle part. Here, it is medial part. First, second, third part. If I say that what is posterior adjacency to the first part? You say that all of this area is covered by pleura. Is pleura. Here is the second part. Look at here, the third part. 1, 2, 3. Yes? First part, second part, third part. What is the anterior adjacency of the third part? What do you see?
First.
Yes. Here I have a vein. Which vein?
Subclavian vein.
Yes. Subclavian vein is anterior adjacent of the third part of this area. Okay? So here I have subclavian
Vein.
vein. 1, 2, 3. 1, 2, 3. Yes? What is posterior adjacent of the third part? It is third part. What is posterior adjacent?
First row.
Middle scalene. Yes. So here I have middle scalene. Yes. Middle scalenus muscle. The second part. What is anterior adjacent of the second part?
Anterior scalous muscle.
Anterior scalenus muscle. What is posterior adjacent?
Pleura.
Pleura. Yes. And also you know that between anterior scalene and middle scalene, between these two muscles, we have brachial plexus. Yes.
Yes.
So the brachial plexus also are located at this area. Okay? Brachial plexus are located posterior and superior to this
Third.
muscle. What is inferior adjacency of the third part? First three. Yes. Inferior adjacency of the third part is
First.
Okay?
Okay.
Go to the branch of subclavian artery. According to these pictures and according to the insertion of the anterior scalenus muscle, I separated the branch of subclavian arteries in three parts. First part, second part, and
Third
third
part.
part. The branch of the first part, look at here. The branch of the first part of anterior scalenus muscle. Okay? The first artery is vertebral artery. Vertebral artery is branched from posterior view, and it is the first branch of the subclavian artery which travels superiorly to arrive to the transverse foramen of the cervical vertebra. Okay? Here, I have a muscle which is located in the anterior to the body of the cervical vertebra. Longus coeli. Okay? Longus coeli. What is longus coeli? Longus coeli is located lateral and anterior to the body of the cervical vertebra, and laterally here I have another muscle. Which muscle? Anterior scalenus muscle. Okay? This area, which artery we have? Subclavian artery. Okay? This triangle is named vertebral triangle. Okay? Vertebral triangle is medially by longus coeli muscle. Longus coeli muscle is located anterior to the vertebra. Laterally, anterior scalenus muscle. Inferiorly, subclavian. Which part of subclavian? First part. It is anterior scalenus muscle. Okay, medial to anterior scalenus muscle I have first part. So, vertebral artery branch from the first part and insert two vertebral triangle to arrive to the transverse process of number 6, not number 7. Okay? Then travel superiorly in the transverse foramen of the cervical vertebra
5.
to arrive to the base of the skull, and then it pierces it pierces posterior membrane of atlanto-occipital joint and arrive to the skull. Okay? Vertebral artery. You know that vertebral artery is located anterior to the perivertebral muscles. Also, at this area I have another artery. After internal artery, here, at this level, I have internal thoracic artery. You study internal thoracic in the thorax, yes? It is separated from the first part of
Subclavian artery.
It travels posteriorly and anterior to subclavian vein. Okay? Anterior to subclavian vein, to lateral to the sternum, and posterior to the third to the seventh rib. It made two branch. Muscular friendly? Superior.
Superior.
Okay? Another branch at the level of internal thoracic, here, I have a trunk. Which trunk?
Cervical trunk.
Yes. Cervical trunk. What are the branch of the cervical trunk? I say that cervical trunk has this branch. The first branch of cervical is suprascapular.
Scapular.
Scapular. Another branch is superficial cervical. Another branch is inferior
Thyroid.
thyroidal. Okay? Inferior thyroidal. They are three branches of cervical trunk. Suprascapular artery travel laterally anterior to anterior scalene muscle, also anterior to phrenic nerve, because phrenic nerve is located anterior to scalene muscle, to arrive to posterior part, to the third part of subclavian artery, and then travel posteriorly to arrive to the superior border of scapula. Yes? And then it travel in the superior to the scapular foramen, suprascapular foramen, to make blood supply for the muscles in the supraspinous and infraspinous fossa. Okay? Another artery is superficial cervical. Also superficial cervical, maybe instead of superficial cervical, we have a branch which is named transverse cervical branch. Okay, but by now you should learn that we have superficial cervical. When superficial cervical travel laterally, also it arrives to anterior part of the anterior scalenus muscle, and then travel laterally to arrive to anterior border of trapeze. Superficial cervical, when arrive to trapezius muscle, it's made two branch, ascending branch and descending branch, which innervate the muscle of the back. Inferior thyroidal, okay? Here, I go inferior thyroidal. Look at this area. At this level, we have inferior thyroidal. Inferior thyroidal, which travels superiorly, has this branch. the branch of inferior thyroidal artery. One branch of inferior thyroidal which travels superiorly is named ascending cervical. Ascending cervical. Another branch of inferior thyroidal is a branch which goes to the larynx. It is inferior laryngeal. Do you remember superior laryngeal?
No.
Superior laryngeal was a branch of superior thyroidal. Superior thyroidal was a branch of external carotid artery. Yes? So they are just like similar together. From superior thyroidal we have superior laryngeal. From inferior thyroidal we have
Inferior.
inferior laryngeal. Another branch is glandular branch. Glandular. Okay? Which glandular branch go to the thyroid gland and make blood supply for thyroid gland. Okay? Another part from costocervical return to this slide. Look at this slide. Here. Thank you. Posterior to anterior scalarius muscle, we have second part of subclavian artery. Yes? Second part of subclavian artery in the right side, we have a branch which is named costocervical trunk. But in the left side, costocervical trunk is branched at this area. Okay? Costocervical. But here, at this area, we have costocervical. Okay? Costocervical trunk. In the right side, branch from second part. In the left side, branch from first part, near the anterior scalarius muscle. Costocervical travel posteriorly, just superior to the cervical pleura. Okay? Superior to cervical pleura, travel posteriorly to arrive to the anterior surface, to the neck of first rib. When it arrives to the anterior surface, to the neck of the first rib, it made two branches. One branch is descending, one branch is ascending. Ascending branch is named deep cervical. Okay? Costocervical. It has descending. Which descending? Do you remember the blood supply of the intercostal space?
Yes.
The first and the second intercostal space at posteriorly is supplied by which artery? By descending branch of costocervical artery. So, descending branch may once and whose posterior intercostal artery. Okay? Costocervical trunk travels posteriorly to arrive to anterior surface of the neck of the first rib, make two branches. Descending branch made the first and the second posterior intercostal artery. Ascending branch, okay, is named deep cervical artery. Okay, deep cervical artery. From the third part, here, from the third part, we have another trunk, which is named dorsal scapular artery. Okay, dorsal scapular artery is branched from the posterior view of the third part of the subclavian artery, which travel posteriorly between the brachial plexus to arrive to the
لا تسمص مرسي.
to arrive to trapezius and then travel inferiorly to make blood supply for trapezius, for rhomboid and for latissimus dorsi muscle. Okay, dorsal scapular. But sometime maybe we don't have dorsal scapular. Okay, sometimes maybe instead of dorsal scapular we have transverse cervical. Transverse cervical artery. What is transverse cervical? Transverse cervical is a branch of thyrocervical. Look at here. Thyrocervical has these three branches. Maybe instead of superficial cervical, we have transverse cervical. So, transverse cervical travel laterally and when arrive to anterior border of trapezius, it may to branch superficial cervical and dorsal scapular. Okay? Important. What time is it?
11:30.
Okay. We have enough time for brachial plexus. You study brachial plexus in the upper morning. Okay?
Okay.
So, we can explain brachial plexus.
If you ask me, maybe you will be able to answer it.
Okay.
I'm not sure about its name.
I can explain. Explain for the beginners.
Explain?
Yes.
I will come. Yes, come here. Without
His handwriting is
Okay,
bad.
give it to me. Yes, every student can write here according to the paper.
Yeah, right.
Okay. To me? No. Okay.
سيد موجود. C4 وين؟
لا لا ما هي
يلا. يلا خليه يكمل اول شيء. ايه سوبريور ترانك سي 7 وسي 8 ميديال ترانك.
7
ميديال ترانك. ايه 8 والتي 1 انفيريور ترانك. خوش هسه كل ترانك سوي انتيريور وبوستيريور. ترانك
Yes.
ترانك كل ترانك سوي انتيريور وبوستيريور.
كل واحد anterior superior.
لا بوستيريور.
Anterior
انتيريور وبوستيريور. انتيريور وبوستيريور نفس الشيء. الجوانب نفس الشيء.
posterior مالته
اوقف خلي كمل.
سوي واحد.
الميدل ثلاثة عشان
بس بعد واحد الانفيريور هم مسوي انفيريور ترانك هم مسوي انتيريور وبوستيريور.
ايش تسوي؟
هو هذا بس اكتمالك هذا بس باخر البوستيريورات ثلاثة نجمعهم بالنص. البوستيريورات ثلاثة نجمعهم بالنص. ايه لازم نسويهم بخط واحد. ننزل هذه بوستيريور ترانك بوستيريور كورد بوستيريور كورد
اي بوستيريور كورد
بوستيريور كورد. اول اثنين انتيريور اول اثنين نسويهم لاترال لاترال كورد.
واخر واحد الانسير مالته
انفير
هو اللي
ميديال كورد الانتيريور اي
واحد يسميه
واحد اي سوي ميديال كورد. هسه
من سي 5 خذ دورسال سكابيلا
اوقف هو خليك
من سي 5 دورسال
من سي 5
نزل هيك عليه
No, don't help me.
سي 5 لا واحدة يلا خوش لا بس الخامس دورسال دورسال سكابيلا. سي 5 وسي 6 وسي 7
6 وسي 7
اول ثلاثة يعطينا لونج ثوراسيك
واحد يعطيك لون في راسك نعم
ايه
عرفتي
هاي سواها خريطة لونج ايه لونج يلا ما يخالف نعم
Yes, dorsal, scapular, and long thoracic, they paired a muscle. Which muscle? Middle scalenus muscle. Okay, the branch of the root and the branch of the trunk, they are assessed also in the supraclavicular part of brachial plexus, which they are located in the posterior triangle of the neck. Okay, so these two nerves, they are from root or from trunk?
روت
Root. These two nerves from the root are the nerve of the brachial plexus, and also we have two nerves from trunk.
Yes.
Yes.
suprascapular
No, don't help me. From trunk. He said that suprascapular. Suprascapular is a branch of which trunk?
اول واحد اول ترانك اول ترانك
Yes. From superior trunk, yes, we have suprascapular and also
Subscapular.
nerve to subclavius muscle.
Subclavius.
Okay, nerve to subclavius muscle from superior trunk. Superior trunk is made by which root?
C5 and C6 C6
C6. These two roots make superior trunk. Okay? Do you remember accessory phrenic nerve?
Yes. Yeah.
It was a branch of?
Middle.
No. Accessory phrenic nerve is a branch of nerve to subclavius muscle. Okay? Nerve to subclavius muscle is a branch of superior trunk. Superior trunk is made by C5 and C6. So I can say that phrenic nerve is from C3, 4, 5. Okay? Thank you.
احسنت
Phrenic nerve.
شو صفق لك قلت لك حرف هذاك
Phrenic nerve is from C. Accessory phrenic. Accessory phrenic is a branch of subclavius, yes? Subclavius. Subclavius is a branch of superior trunk from C5 to C6.
C3
and C6. So, during an accident, also you should know that accessory pharynx does not, every people does not have accessory pharynx. In some people we have accessory pharynx nerve. In a people who have accessory pharynx nerve during accident, okay, if we have rupture of pharynx nerve, the respiration of these people does not impede because it has another nerve from C6. Okay?
Which one?
I said that in the people who have accessory pharynx nerve,
Yes.
if the pharynx nerve is completely ruptured, okay? If we have rupture of pharynx nerve, and you know that I say that accessory pharynx attached to pharynx nerve in which level? Anterior to the neck of the first rib. Okay? Excuse me, anterior to the first rib, accessory pharynx attached to pharynx nerve. So, if I have the rupture of the pharynx nerve at this area in the neck, these people who have accessory pharynx, they can respiration. Okay? Their respiratory system does not impede because accessory pharynx has a branch of C6. Pharynx nerve has a branch of C3 to C5. Another point.
So,
Yes.
what about the another pair? It's very isn't it? So, yes, the another one come here.
Yes, the pharynx nerve in the we have two pharynx nerve. Yes, you are true. The left side is innervated by left pharynx nerve. So, if I mean that if, for example, in the spinal cord injury, okay, for example, in the spinal cord injury, of if I have both side cutting of the damage, yes. Inferiorly, I have nerve to from C6, which help this people. Another point is the sensory point of the neck. You know that I have, I say that I have 4 superficial nerves in this area. Yes? These 4 nerves are emerged in the posterior border of SCM. Yes? In the midline posterior border of SCM. What are these 4 nerves? Lesser, occipital, greater, auricular, transverse, cervical,
Subclavian, clavicular.
clavicular. Yes? And these 4 nerves are emerged in the posterior border in the midline of SCM. So, if you want to do a small surgery at this area, which you need to paralyze it, you can inject the anesthesia liquid in the posterior border of SCM. Okay? Posterior border of SCM. But in some patients who have heart failure, who have respiratory failure, you cannot do this anesthesia. Why?
Because of
blood pressure?
No,
No.
is it because of the accessory pharynx nerve?
Accessory. So accessory, for example, I anesthesia also the accessory nerve. Yes, pharynx nerve. Because I say that pharynx nerve is a branch of cervical plexus. Yes. Also these 4 superficial branch are from
Cervical
plexus.
plexus.
If I inject this anesthesia liquid at this area, maybe I can also
Injured.
not injury the anesthesia for the pharynx nerve. And in this patient, you cannot do this surgery.
But still there is like accessory pharynx nerve. You can't break with accessory pharynx nerve.
No, I said that accessory pharynx is not available in all people.
Ah.
Okay? Sometimes, occasionally, maybe we have accessory pharynx nerve, not all the people.
Doctor, what about the another one? The another pair? It will be held, but in respiratory failure, it will not be affected, is it?
Respiratory failure? Yes, I said that because the phrenic nerve, because innervates the diaphragm. Okay? So, in this patient, in the people who does not have respiratory or cardiac failure, okay, I said that you can do and inject the anesthesia in one side because another side help, yes. But in the patient who have cardiac failure, who has respiratory failure, you cannot do this surgery.
It will be hurting.
Yes. Subclavian steal syndrome. What is subclavian steal syndrome? Look at this slide, read this slide, and say me that who can explain the subclavian steal syndrome.
Well, let's effect on the
Maybe.
Yes, yes. Explain this syndrome.
The subclavian artery becomes narrower, so the stenosis becomes
Yes.
narrow, and the blood cannot pass through it very well. So
Yes.
the blood enters the vertebral artery, and it travels. I think it travels through the vertebral artery and reaches, this area here. But it doesn't reach the brain properly, so it might cause stroke in the brain ischemia. Am I right?
It makes brain ischemia.
Yes.
Partially you are good. Any opinion? Yes, you.
So the stenosis of the subclavian artery at the start near the vertebral artery, causing.
Okay, the point is here. My question is this: that this stenosis, look at here. Look at here. In the right side, I have brachiocephalic trunk, yes. Which brachiocephalic? Main, subclavian, and common artery. Okay? And here I have vertebral artery. Yes? Subclavian steal syndrome. It means that the blood is stealing from another part. For example, if I have narrowing or I have obstruction of the subclavian artery in the right side, it means that it steals the blood from left side. So, my question is here. This syndrome is occurred if at this level I have obstruction or at this level I have obstruction.
The second one.
Yes.
No, the first one.
This
Yeah,
one.
yes. Because if I have obstruction after vertebral artery, it does not help the patient. Okay, because it is obstructed. So this syndrome is occurred when the obstruction is before the vertebral artery. Okay, because two vertebral artery when arrive to the skull, they attach together and make basilar artery. Basilar artery is located anterior to pons. in the brain stem. Okay? So, here and here, okay, they make basilar artery. Okay? So, if I have obstruction at this area, the blood insert through vertebral artery. Okay? The direction of the blood usually is from inferior to superior, but in this patient, we have opposite direction. Okay? We have from superior to inferior and insert to the subclavian artery. It is named subclavian Steele
syndrome.
Okay, do you have a question? No.